Hello, my name is Karen Mariner. I'm a licensed health insurance agent in the state of California. I work with calhealthagent.com. We specialize in working with individuals and families to find affordable, high-quality health insurance. Today, I'm going to talk for the next 15 minutes or so about health savings accounts and how this strategy can help you save money, especially on your out-of-pocket expenses. The roadmap for this next 15 minutes is talk about health savings accounts, specifically what is an HSA, how can a health savings account save you money, give you an example of how it works for, in this case, an early retiree couple, how to use the funds, and who is a good health savings account candidate. First of all, let's understand what a health savings account compliant healthcare plan is. In order to take advantage of the strategy I'm going to lay out, you must be enrolled in a health savings account compliant health plan. That means that there's a big chunk of expenses, the very first money that you spend, called first dollar expenses, that are coming out of your health savings account. This is money you're putting aside in an account with your bank or any other bank that offers a HSA plan, account I mean. And that's what you're going to spend on your health care for the first $4,500. So in this case, from $0 to $4,500 of expenses in any given calendar year, you're going to spend that money that you're putting away in your health savings account. From $4,500 to $6,250, the plan is going to pay 60% of the cost, and then over $6,250, which is the maximum out-of-pocket expense in that particular plan that I'm thinking about, the plan pays 100%. This is a very typical structure for a health savings account compliant health plan. The note at the bottom calls out that preventive services, physicals, blood work, flu shots, cancer screenings are all covered 100% before that $4,500 ever has to get touched. So for somebody who doesn't do a whole lot in the healthcare system, besides their annual physical, this could be an excellent strategy. Here are the rules of the road. First of all, understand that in 2016, the tax deduction, this is a deduction that shows up on the first page of your 1040 called HSA plan or Health Savings Account Plan deduction, is $67.50 for a family of 2 or more, or $33.50 for a single tax filer. In order to get this deduction, you must be enrolled in an HSA compliant health plan such as what I showed on the last screen. The funds you accumulate in your health savings account must be spent on qualified expenses until you're 65. Then you can actually use it for qualified expenses and your Medicare premiums. Any unused funds in the account at the end of the calendar year will be rolled over to next year. Here's an example of a retiree couple. So they're both 62. They've left the group plan that they were on when they were working. They're not ready for Medicare. This is the most expensive time of life as far as medical premiums go. So I wanted to use it's a particularly good example. You can see how much can be saved both in the tax arena and in the premiums. So in this case, this couple, if they chose to go with a silver PPO, that is not a health savings plan compliant plan, their premium is $1,578 a month. You can see right here, which is $18,000, almost $19,000 a year. Whereas if they're on a bronze HSA plan, their premium drops to $1,282 or $15,000 and change for the year. So let's say in this example, they got their physicals, they got their flu shots. That's zero cost on any of these plans, whether you're on silver or you're on bronze. Between the two of them, they had 2 primary care visits this calendar year example. On a silver plan, they paid $45 each for each of those visits. That's $180 for 4 visits. On the bronze plan, they're not paying that $45 copay. They're paying for the cost of the visit. And in actuality, the cost of a primary care visit when you're staying in network is about $100. So they're paying $400 instead of $180 for their 4 primary care visits. They're on a couple of 4 generic medications. Their co-payments are $60 a month for those medications because it's $15 a med. That's $720 a year. On the HSA plan, they're not paying their $15 a month. They're paying the full cost, which is $120 a month or $1,440 for the year. But if you take into consideration the premium, the primary care visits, and the generic medication, they're still saving about $2,000, a little bit more, by going the HSA route. The couple takes that money that they're saving from the premium and pays it to themselves in an HSA account to pay for these out-of-pocket expenses. Here's an example of sort of a 3-year example of this couple. So they start out, they've got nothing in their HSA in year 1. They start putting in $250 a month. Basically, that's what they're saving by not being on a silver plan. That's $3,000 a year that accumulates in that plan. They spent $2,000 on their pharmacy and their primary care visits. So at the end of year 1, they've got $1,000 to start off year 2. Start off year 2 with their $1,000. They decided, we spent the money last year, so let's up our contribution and pay ourselves $400 a month into our health savings account with our bank. That's $4,800. They spent a little more this year, $2,200 on their out-of-pocket expenses. And now at the end of year 3, they've got $3,600 left in that account. End of year 2, Start off year 3 with that $3,600. They drop down to $250 a month. Again, they're getting close to Medicare members, so they're going to tail off on these contributions. They contributed $33,000 while they can still get the tax deduction. They spent $2,500 this year on medication and doctor visits. And so now they're ending year 3 with $4,100 left in this account. In addition to having that $4,100 set aside, they contributed $10,800 over the course of these 3 years, and they avoided paying taxes on that money, which saved them $3,240 in taxes. And this is kind of the holy grail, because most of us are in about a 30% tax bracket. So sheltering $10,800 from your income saves you about $3,200 in this case in taxes. Where does this show up on your 1040? This is page 1 of the 2014 1040. And you can see in the adjusted gross income section at the bottom of the page, there is the health savings account deduction right there. While I'm talking about it, I might as well show a picture of page 2, which also has an interesting new wrinkle on it as of 2014. And that, of course, is the penalty that people are paying for not having health insurance. Just thought I'd throw that plug in. How to use the funds. HSA funds, you're allowed to use them tax-free on eligible medical and dental expenses, such as co-pays on office visits and lab tests and outpatient procedures, inpatient, anything like that. Vision expenses, dental expenses, co-insurance on surgeries, and prescription drugs. And of course, vision includes glasses. By far the easiest way to access the funds in your health savings account is to get an account that offers you a debit card. These banks all offer debit cards. Basically, the way that you use it is when you go to your doctor's office or you go to the pharmacy counter, instead of using the typical payment method that you would use, maybe it's a check, maybe it's cash, maybe it's your regular credit card, you whip out your health savings account debit card, and you're immediately right there, real time, pulling out funds from this account. And you never have to bother with any kind of reimbursement or filling out forms or anything else. So if you go the health savings account route, I always suggest to my clients that they first call their bank. If you bank with Wells Fargo, call Wells Fargo, see if they offer a health savings account. If they do they offer a debit card feature? And go ahead, and that's going to be the most convenient way to fund that account and to use those funds. Otherwise, there's a bank called HSA.com online, totally legitimate enterprise. I have some clients that are using this. Very convenient and also an option. You actually also earn interest on these funds. It's not a lot, but it's something. Who's a good candidate for a health savings account? Anyone who's looking for a way to shelter some taxable income. So you basically have to have taxable income in order to shelter it. You're not a big user of the healthcare system, as you saw in my example. They're only using a couple $1,000s a year. You know, if you're using the healthcare system a lot, you're still able to shelter your income, but you're probably going to exhaust the fund every year. So I'm not sure it's as great as when you actually just don't use your insurance very much. You're not eligible for any of the Affordable Care Act enhanced silver plans with cost-sharing subsidies. And if you have never heard of that, then most likely you're not eligible. These are people who have adjusted gross income of lower than 250% of the federal poverty line. You're looking for a way to create a long-term plan as you march toward Medicare. At the time when the premiums are most expensive, you're not eligible for a subsidy, or maybe you are, but it still feels expensive to you, and you want to do something that's a win-win. Take the subsidy money from Covered California and apply it toward a health savings account option, and then you're basically using government money to get a tax deduction. Doesn't that sound fun? You're relatively healthy and relatively financially savvy. And that means that you understand about how taxes come together and that you're comfortable with various kinds of tax shelter strategies. If you have any questions and you're in the state of California, don't hesitate to email me. My email address is right here, or call me at my home office, which is right there as well. Thanks for listening. Have a great day.